Do steroids cause prostate cancer? So that's the discussion we'll be having today. I'm Dr. Downey and welcome back to another video. So I'll just introduce what the prostate is in case for those who don't know, it's a gland about the size of a walnut that sits right below the bladder. It's responsible for secreting fluid that nourishes sperm and protects sperm, which is needed when traveling to fertilize an egg. It is also the site of 5-alpha reduction of testosterone, which is where testosterone is reduced into one of its derivatives called dihydrotestosterone, or DHT. That, for those who don't know, that's commonly associated with things like hair loss, facial hair growth, all of the male secondary sex characteristics like body hair growth and stuff like that. So the issue with this topic about steroids in particular is it's very broad, and obviously there aren't many, if any, studies on steroids in particular and their effect on the prostate. So we're going to use a surrogate measure in this case, and that's whether or not testosterone levels are linked to the development of prostate cancer, and we'll see what the science says behind that, because we can't really, there aren't any studies on that, but one might assume that a DHT derivatives like masteron, I think primobolan and things like that would influence the prostate more, but we'll see. One of the reasons you may think steroids or DHT in particular does play a role in prostate cancer is because it does lead to the enlargement of the prostate, and that isn't really debatable. And in order to treat active prostate cancer, we use anti-androgen treatment, which essentially reduces things like DHT and circulating testosterone. However, there are multiple studies that have shown that higher testosterone levels do not put one at a higher risk of developing prostate cancer. One study on steroid abusers found that whilst they had high circulating levels of androgens, they were not at an increased risk of developing prostate cancer either. So it seems that although that androgens, whilst necessary in the development of prostate cancer, isn't necessarily sufficient to cause prostate cancer. But this scenario obviously changes in individuals who have established prostate cancer, because obviously one of the treatments is to reduce circulating androgen levels. And a lot of prostate cancer cells have been shown to have more androgen receptors. These are in vitro studies. And thus, using exogenous hormones in established prostate cancer could lead to more rapid development. But for those who don't know, this is a bit of a shock, but people on TRT actually tend to have more favorable outcomes in terms of prostate cancer than those not on TRT. And why is that? And that's actually due to bias. In the case that, I think it's detection bias, but people on TRT in particular suffer less from aggressive prostate cancer because they are more likely to go for health checks and PSA checks and digital rectal examinations, because they know of the risk of testosterone and enlargement of the prostate, so they're more likely to have it examined. So what are the suggestions for those worried about prostate cancer and on androgens? Well, go for. It's recommended that those on exogenous hormone treatment go for PSA measurements and digital rectal examinations. However, one might find that PSA is actually has evidence against it being used, and that's because it leads to more unnecessary treatment than which leads to more harm than prostate enlargement or prostate cancer would have caused. So there are some debates as to whether PSA or prostate-specific antigen is really needed. And further criticism is that there are no studies in men with extreme superphysiological levels. They just took steroid users who had already used steroids, didn't look at their serum levels, just looked at the development of their prostate and found had no more increased risk of prostate cancer than those not using steroids. And some may cite a study that says androgens have tumor-promoting effects, especially in the prostate. Whilst this could be true, it's found that estrogen does inhibit tumor-promoting factors. So there's a bit of a balance in that, but from the research in the real world, it seems people on TRT have favorable outcomes because they're followed up more closely, and the risk is nil or minimal if there is any. But in terms of enlargement, that's a different topic that I'm going to discuss. Thank you for watching this video. I hope you enjoyed it and that it taught you a few things. Like, comment, subscribe, and I'll see you in the next video. Thank you.